any finding in the hepatitis B combo profile that can make someone eligible to take antiviral drugs? Now, I talked about Livolin earlier. It's just a multivitamin, it's a supplement. Unfortunately, a lot of doctors who may not have very good knowledge of hepatitis B, they may also believe that Livolin is maybe treatment or a cure. No, it is just a supplement. As I say, it doesn't have any antiviral effects. It doesn't do anything to the virus. It just helps as a supplement, as a multivitamin to the liver. Then any finding in the hepatitis B combo profile that makes somebody eligible to treatment. Now, the combo profile, it cannot be used in isolation. There's the hepatitis B profile or panel or combo that we do. It can't be used in isolation. It has to be used in conjunction with the viral load, the liver function, the abdominal scan to determine if one is eligible for antiviral drugs. Unfortunately, some people will do the profile and they will say, oh, hepatitis B E antigen is negative, you don't need treatment. Or core antibody is negative, you don't need treatment. No, one should have a full workup, to determine if treatment is needed, or not. The other one is many thanks to the organizers. Many thanks to the organizers. Chronic hepatitis B with viral load of greater than 10. I believe that should be less than 10 because greater than 10 could be anything. It could even be thousands or millions. LFT normal except for bilirubin, slightly high, but my doctor said it's nothing to be worried about. AFP very okay. Please, what is your take on this? Now, if the viral load is less than 10 and liver function is normal, bilirubin may be slightly elevated because a number of things outside hepatitis may cause bilirubin to be high. And with the normal alpha-fetoprotein, abdominal scan should be normal. Then it is right that your doctor says everything is okay, but you still need to be monitored continuously, to know if it becomes active later on. I said earlier, liver function every 3 months, viral load every 6 months, abdominal scan, AFP every 6 months. And please, my first pregnancy I was not on antivirals, but I'm trying to get pregnant again. Now I'm on entecavir, which is working well. Is entecavir safe for pregnancy? Now, entecavir is not safe for pregnancy. So you may need to see your doctor, so that the entecavir could be substituted to something, that is safe in pregnancy. And, you'll be monitored through pregnancy to be sure that the drug works. So entecavir is not safe, please. Which of the hepatitis is more dangerous, sir? Well, hepatitis B and C, they are both very dangerous. I wouldn't say one of them is more dangerous than the other, but they are both very dangerous. But considering the fact that C is curable, if one identifies hepatitis C on time, without any complications and is cured, I think that one is less dangerous compared to B that doesn't have a cure, but they are both dangerous. Then next question, assalamu alaikum, I'm positive hepatitis B. I recently did LFT and alkaline phosphatase 198. Should it be a reason for concern? No, well, you have to see a doctor because the liver function is not the only thing to be done. I mean that you need to do a number of tests. And the alkaline phosphatase at 198, we need to know the normal value because different labs may have different reference values. If the reference value is less than 240, then 198 is normal. If the reference value is less than 92, then 198 is high. Then, of course, you should see your doctor, probably get a referral to a liver specialist. Then, can I have this presentation via email? I think the organizers will address this as well. What is the doctor's comment about treatment for somebody with hepatitis B since 2018, diagnosed with viral load of 500 copies per mil, 5,000 copies per mil? Now, well, when we talk about viral load, we use copies, we use IU per mil. It's a factor of 5. So 1 IU per mil is 5 copies per mil. IU means international units as against the copies per mil. So 5,000 copies per mil simply means 1,000 IU per mil. That is considered to be a low viral load. I said earlier that once viral load is less than 2,000, we consider it to be low. So that's a low viral load, but that is not enough. Other tests needs to be done. You need to be properly evaluated. and monitored to determine if treatment is needed or not. Then what is your take on using getinomide tenofovir tablet? Yes, getinomide is a very good antiviral, so you can use getinomide. It has the added advantage that it does not affect the kidneys. It has no potential of affecting the kidneys, unlike other, formulation of tenofovir. It's one of the new formulation of tenofovir with that added advantage. So it's a good one. You can use it if it's been prescribed for you. What if after confirmed HBV positive and after treatment, the viral load now becomes non-detectable? Can the viral load still increase? Yes. If the viral load is undetectable, they could write less than 10, less than 15, or less than 20, or they just write undetected. It's important that one still continues to monitor every 6 months because it may still become detectable. It may still increase. It may still get to levels where treatment will be needed. So just a one-time viral load is not sufficient. Okay, so the organizers have shared this. You can view a recording of this lecture on our Facebook page. So you can click on that link to see it. Sorry, I think. Sorry, just a minute. Okay. I need to see you. I need your contact and help. So the organizers will look into this. We will also upload the recorded video on our YouTube channel. So you can also go to the YouTube channel to view it. Then I heard that hepatitis B is born with us. Kindly clear this. Well, we talked about the vertical transmission at birth. Some people may get it from their mothers if their mothers have the infection. So that's where one can get that infection right from birth. Yes. Then to support our cause of providing support to the sick and public health enlightenment, you may use the details of the accounts. Okay, that's been stated by the organizers. And really appreciate you, sir. Where and how can one have reliable tests of ABV, sir? Any standard hospital or standard laboratory should be able to do hepatitis B tests. If there are doubts, you may repeat in different laboratories, maybe like 2 or 3 different places, to be sure of the results. Because there are things we call false negatives. They are the ones we call false positives. False negatives, meaning that the test may falsely be negative while the infection is there. False positive, meaning that the infection is positive while the infection is not there. So if there's any doubt about the infection, you should feel free to repeat it in any other standard lab or standard hospital. Okay, same question that we were born with hepatitis B, so that's mainly from vertical transmission. Then is it possible to be negative in the second test when someone was positive in the first test? So that's why I also talked about the false negative and false positive. So one needs to maybe check in different places. And there are different methods. There's the one we call the test strips, which is about 95 to 97% accurate. Then there's the one we call the ELISA method, done in the laboratory. It's more expensive. That one is about 99.9% accurate. So if there are doubts, one could go to a very good lab where ELISA method could be used to confirm if the hepatitis B is actually there, or not. How long can getinomide be taken? If one is on treatment for hepatitis B, it's potentially a lifelong treatment. Except a cure is found, then we can switch to the curative therapy, and then we'll have a definite treatment. But if one is on getinomide, one should just be prepared that it may be a lifelong treatment, except one is lucky among the 2 to 3% that may eradicate the infection. There could be other circumstances in which we may consider stopping the treatment, but this needs to be discussed, with your specialist. Appreciating you for the presentation. So I think and hope I've been able to address all the questions.
Yeah, thank you, Doctor, we actually have just about 3 minutes more for questions because we plan to wrap everything up by 6 o'clock. A question I want to ask is that for people who want to contact you, what should we release to them? Your phone number or your email or both?
This is a tough question. So I think because we receive calls, I receive calls, severally, and at times I may not be able to pick some calls. Some people may get offended. But if it's email, certainly, once some time is given, I'll be able to respond to emails.
Okay.
Or if people can just send maybe text messages or WhatsApp messages to my phone number, I think that would be better. Likewise, you can release my email so that at least that will also be a good channel of communication.
Okay, we'll do that shortly. Now the last question, which we have the privilege of asking, is well, you run an NGO. We also run an NGO, and you try to educate people to create awareness about hepatitis. So, what are the challenges you face in creating? I mean, the social issues that you confront. We want to learn from that, so that while we are also doing our own program, we know what to. We can learn from what you've actually faced.
Okay, well, with our NGO, I think major issue is funding, because we try not just to create awareness, but anywhere we go to create awareness, once it's a physical meeting, we also try to do some screening, so not just talking about hepatitis, but we want to screen people so that they can know their status. And like in the last World Hepatitis Day, we had to source for funds. Getting funds from people, individual and corporate organizations, could be quite difficult, and considering the economic situation could also make things worse. We had to get some materials for the screening, for hepatitis B and C. So I think that made funding a little bit more of a challenge. Secondly, is getting volunteers. Because with our NGO, it's quite a new NGO. We're just about almost 3 years. And we try to get more members, volunteers, who will be able to participate in our public enlightenment program, in our screening program. And truly, some people expect that they should be paid, rather than just volunteering for this noble cause. And at times, to get people to participate even in the public enlightenment program could be a challenge. At times even the old NGO, you call for meetings, at times people don't attend, members may be busy, unable to attend, and you just have to keep reminding people to participate. And getting people out to attend our programs could be a bit of a challenge. I think basically those things, we're still learning, we're still on the field, and we hope that we'll still learn more and progress further in this.
Thank you. Okay. So thank you for, all those who participated. To give us the vote of thanks, I'll call on Mr. Abdul Wasil Adebi to give us the vote of thanks.
Assalamu alaikum warahmatullahi wabarakatuh. Dr. Lukman Abdul, Jazakumullah khairan, we are very educated. We really appreciate you. May Allah continue to be with you. You say Jazakumullah khairan. We hope that when next we invite you, you'll be ready, available. May Allah continue to be with you. Also appreciate the listener, those who have joined the meeting. May Allah continue to be with each and every one of us. Jazakumullah khairan. Thank you.
Okay. So thank you very much for having me in this program. I very well appreciate the invitation.
Yeah, thank you. The program has ended. We just, as it's quite a number of people requested, we posted the guest lecturer's contact, his email address, and his phone number. But please remember, he said he prefers you to send him WhatsApp messages or text messages. And in the chat also, you can see where we posted a link to this lecture. It was also streamed live on Facebook. So you can watch it live on Facebook, though if the first couple of minutes is it's missing there. But the full lecture will also be posted on our YouTube page in the next 24 hours. And you can also watch the previous lecture we had, which was on cancers, which is also on the Facebook page and also on YouTube. So thank you very much.